we will wait 5 minutes more for others to join the meeting. So and as well, and during the lecture, I hope others will join. So those who missed the lecture, you can watch the lecture uh, online by downloading it from the uh, uh, university portal after several hours after the lecture. So I need some time to upload the video after it was recorded. So how was your summer holidays, guys?
It was good. It was very good and very hot here in Egypt.
Healthy?
Very good and very hot here in Egypt.
Healthy in Egypt? What?
Hot. The
Hot?
weather.
Oh, I
Hot.
see.
Yeah.
That's true. That is why Egypt is not very popular at summer as a tourist attraction. So most tourists visit Egypt in uh, at winter.
We do too. We visit, we go to tropical places in Egypt in winter, but, well, we are not in Egypt in winter. So,
Hello, excuse me, teacher.
Good morning.
Good morning. Pharmacology class will be in Amir Khana or Red Building.
No, Salma, unfortunately the internet connection isn't available on the Amir Khan Street, so that is why I will broadcast from home, and our class will be online.
Okay, thank you.
The reason is that your group is divided to offline and online, and uh, so actually the offline group is also will be online. So hope you have a reliable connection so you can watch the uh, class online. If you can't, uh, that's not much a deal. So you can download the lecture uh, after it will be uploaded. So I think tomorrow it will be available from the educational portal of the university.
Okay, thank you, teacher.
It's my pleasure. So it's 50 minutes already. Let's start a lecture. Welcome to the pharmacology department and welcome to my class. The topic of today's lecture is pharmacokinetics, and what is a pharmacokinetics is how the uh, body answers to the drug. So, and also there is also a different kind of study pharmacodynamics, and pharmacodynamics is a way the drug will influence to the body of the human. So these two studies are interconnected, and one should know well both to predict the safety, the onset of action, and the efficacy of the drug that is prescribed. So today we will focus on pharmacokinetics because the one of the first uh, properties of the drugs that influence the efficacy, the uh, onset of action, the duration of action are vital for the efficacy of the uh, therapy. So, and the pharmacokinetics has four stages, and for one moment. And for uh, those four stages are the following: absorption, distribution, metabolism, and elimination. So every of the stage is connected with another. So the first stage is absorption, and absorption occurs at the site of the administration. There are different sites of administration, and they can influence the speed, the quality, and the duration of the absorption. So this first stage usually is much important because the absorption will influence the all other stages, and also will result in uh, increase or decrease of the final stage, and also will influence on the dose. The proper absorption at the site of administration or injection is very important for the uh, efficacy of the treatment. And absorption is a way of transferring the drug from the site of the administration to the blood plasma. So and depending on the different routes of administration, it can be higher or lower, and also that largely depends on the chemical properties of the drug injected or absorbed, or injected or administered. The second stage is distribution. Distribution is spread of the drug from the blood plasma to the tissues of the body. This phase is pretty uh, self or self-limiting, so the distribution depends on the concentration in different parts of the body. So, and usually the distribution is characterized by the volume of distribution. That means that the higher is the volume, the larger is the distribution. For the drug plasma, so the blood is, for a healthy man, the volume of the drug is about 4 liters. So for the like 90 kilogram healthy man that is in his 40s or 30s, the average volume of the blood is 4 liters. Above that, the tissues, uh, the tissues of the cells, and the intracellular space also adds to the volume of distribution that can vary greatly depending on the um, age and sex, well, either it's female or male, and also on the body fitness, and also the adipose tissue is also can uh, add to the volume of distribution, and that varies greatly as well. So the next stage after the distribution is metabolism. Metabolism starts uh, immediately after the absorption, uh, and one moment, and immediately after absorption, because it uh, it's continuous process. However, the higher is the distribution, the higher will be metabolism, and uh, the metabolism is usually takes place in the liver. So some other tissues also will transform, will modify the drug, injected or taken orally, and some drugs are prodrugs that require to be activated in the liver or other tissues before they will make some pharmacological action. So the metabolism is a pretty uh, complicated stage that can be divided roughly to two phases, phase 1 and phase 2. And during the phase 1, the uh, the drug is usually uh, um, transformed by oxidation and hydroxylation, while during the second stage, phase 2, the drug is usually transferred by conjugation or acetylation. So during these two stages, the properties of the drugs will vary tremendously, and the usually the uh, goal of the uh, goal of the metabolism is to increase the uh, hydrophility of the drug and prepare the drug for elimination. So elimination is the fourth and the last stage of the pharmacokinetics, and elimination means that the drugs will leave the body. So, and this stage is also important because the faster elimination will take place, the faster the uh, plasma drug plasma concentration will decrease, and the uh, the lower will be the concentration of the drug, and the lower will be the uh, effect will decrease as well. So elimination is mainly done by urine and uh, kidneys, by urine, but also some drugs can be uh, eliminated by the lungs, especially the volatile drugs, and also all drugs appear in all the fluids of the body, including the bile, tears, breast milk, saliva, sweat, and feces. But most drugs are eliminated by urine, and there are small amount of drugs that are eliminated by bile, so they will appear in feces because bile actually is injected to the is secreted to the intestine. So these are 4 stages of the pharmacokinetics, and the abbreviation for the stages is ATME. So if you add me, so ATME is easy to remember because you add your friends. So if you add me to your friend list, so then you can remember the pharmacokinetics stages. There are 4 stages: absorption, distribution, metabolism, and elimination. The absorption can take place at different sites of administration, and depending on the route of administration, the absorption will take different time. And the absorption will depend also, the rate of absorption will also depend on the way of administration. Roughly, all ways of administration can be divided to 3 main ways. These are enteral. Enteral is around here, and the second is parenteral. Parenteral is here. Parenteral is divided to 3 types. First is intravenous. Second is intramuscular. That is actually intravenous. Actually, is usually here. Or second is intramuscular. Intramuscular is usually on the cheeks. So, and subcutaneous is usually here, somewhere here. So the parenteral way can be done by injection. Injection means that the drug is injected by the syringe, and this way, in that case, all the dose will be injected at once. So during the short period of time, usually about 5 seconds. And also the second way of parenteral injection is actually not injection, but infusion is done with the system. This is a system. System is connected with the tube and needle with the vein, and also there is a small regulator on this tube that can be increased or decreased, so that allows increase or decrease the flow of the drug. So usually the speed of the flow is defined by the number of the drops per minute or per hour. And also there is so the same. So this is parenteral. Parenteral means that it's not through the GI, but is with the through this through the damage of the screen. So the opposite of the parenteral is enteral. Enteral means that through intestine, because enter is a so intestine. So enteral is actually oral. So enteral in Latin, oral in English. So oral ways of administration include the mostly are tablets. So tablets will go through the mouth to the GI system, and this is the main route of administration for most of the drugs because it's more convenient, it's more economical, and more pleasant for the patient. Parenteral routes are not pleasant for the patient because, especially for the children, making an intramuscular injection usually is a problem, and children will not allow you to do the intramuscular injection. But however, there are some circumstances that will require parenteral injection, and uh, those are mostly used in the hospital. However, they can also be used in the outpatient clinics too. So, besides these three main ways, the oral, parenteral, and uh, uh, oral, parenteral, and other. So actually the three, we can divide them roughly to three. So first is parenteral, second is oral, and third is actually all other ways. So all other ways are displayed here. So we will go from the top. So otic way is actually only, sorry, yes, only for the diseases of the ear. So for hearing diseases. So and there are limited number of drugs that can be administered uh, otically, and they are administered in drops. So special otic drops are designed to prevent damage to the ears, and there are limited number of substances that can be administered. For example, boric acid can only be administered, and some antibiotics in drops, and that is all. So there are not so much solutions you can administer through the ears. Second is ocular. Ocular also in drops and is directly administered to the eye, sclera of the eye, and those solutions, there are a large number of solutions that can be used for the eyes, including all water-based solutions, and also antibiotics are available for the eyes, and there are plenty of over-the-counter solutions for the um, for the contact lens care, and also to uh, prevent the dryness of the sclera of the eye. So this is the very common drug uh, in adults, especially in older ones. So then the inhalation is done through the lungs. So the can be uh, uh, can be done using the inhalator, that is aerosolum, through the mouth, but not to the GI system, but to the lungs. So this is the oral way. Oral way is very fast. Onset of action is very fast. So the drug will um, will start effect very fast, and usually used for asthma. Then the sublingual and buccal. Sublingual means that the tablet is placed under the tongue, and because of the ability uh, of the blood vessels under the tongue to absorb the drug, small molecules of the drug, not every drug will absorb through this way, but those that can pass uh, they absorb fast, and uh, the the way is very reliable. Sublingual way is mostly used for natural glycerin to prevent the congestive heart failure. So the buccal way is the same as sublingual, but instead the tablet is placed between the cheek and the gum. So the transdermal way of absorption is a new way that is become available recently, and includes the transdermal patch that is glued to the skin, usually to the large muscle that is free of the fat, because the fat will slow down the absorption. And transdermal patch uh, has a special layer that allows the absorption through the skin without the damage of the skin. Then epidural is a very rare method of absorption, and uh, so the epidural is done directly to the spinal cord through the special syringe. So this is a very dangerous way, because uh, uh, the uh, the surgeon should be very careful with the placement of the syringe. So only done in hospital. And then the rectal way is used seldom, because it's not very pleasant for the patient, and the uh, candles are so the inserted inside the rectum. Uh, then they melt down inside and absorb through the rectum, that has a special uh, blood vessels that that bypass the liver, and that is why the drugs appear in the blood uh, bypassing the liver metabolism. So this can sometimes be helpful. So and topical ways is usually used for skin diseases, and that can be ointments, creams, and many other solutions also, but mostly ointments. And most of the time are used for the skin disorders. So these actually are the ways of administration. There are plenty of the ways, and depending on the disease and the drug, uh, there are sometimes limited ways of administration. So some drugs have only one or two, other drugs have plenty of ways. So depending uh, mm, on the chemical properties of the drug, some of them may be or may not be available. And also there are uh, extended release drugs that actually can um, can can be administered, and so we will return to that later. So this is a ways of administration. So and the next is the differences in administration. And so for the uh, parenteral injection, the 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 so the way of administration is different. That the intramuscular is actually is deeper and will go directly to the muscle, and the subcutaneous is not as deep, so it's done with the angle, and the duration of action will be longer, because this layer will, so the drug that is injected in this layer, in the upper layer of the skin, will distribute slower. Because subcutaneous tissue is uh, has uh, less blood vessels, but muscle has more blood vessels, and that is why the drug will distribute faster from the muscle. That is why intramuscular injection is faster. The intravenous injection is the fastest one because the drug will directly go to the blood vessel. So on this graph you see the uh, increase in plasma concentration by time for the intravenous injection is red, and for the intramuscular injection is blue. So the intramuscular injection is the peak concentration is much lower, so it's about 3 times lower than for the intravenous injection. And this is because the distribution from the muscular, so from this muscle, is slower, because when you inject intravenously it will go and increase very fast because you directly inject to the plasma, to the blood. For the intramuscular injection you first inject to the muscle and then the drugs will distribute from the muscle to the blood. The uh, more the higher the larger the muscle, the faster it will distribute. And for the second stage of the pharmacokinetics, that is distribution, will take place with different ways, different mechanisms of the uh, transfer of the drug. That is, can be passive diffusion. Passive diffusion is done from one side to another side, so from the side of the higher concentration to the side of the lower concentration. And of there is no um, any special mechanism for the passive diffusion. It will take place everywhere. The uh, the drug should be water soluble and can pass through the cell membrane pores, or if the drug is fat soluble, then the drug can pass through the membrane. So in either ways the drug will diffuse uh, easily or not easily, so that the diffusion is usually the slow process. It will be not very fast. Then the second way of diffusion is actually facilitated diffusion, and drug will use a special drug transporter that will take drug from the one side of the membrane and then release it from the another side of the membrane. So the same as the bus will take you from the one bus stop and then leave you in the another bus stop, so you can uh, reach the university building and classes. So the same way the drugs will take the same way the transporter will take the drugs and release them inside the cell. So it will take it outside and release inside the cell. The third one is active transport. The active transport is the same as facilitated diffusion, but it's usually faster and it will use some energy, from ATP. So ATP is consumed during this process, and usually it will be more effective, so it will be faster, and it can it can uh, move the drug from the place of the lower concentration to the place of the high concentration. While the passive diffusion, it will only move from the high concentration to the low concentration. And there is also a fourth way that is pinocytosis, but it's very rare, and it's only for fluids. And pinocytosis is when the membrane will just grow, catch the fluid, then immerse in the membrane, and then uh, throw it out from the another side. So uh, the bioavailability is very important feature for every drug, and uh, the bioavailability is calculated by dividing the oral dose. So the amount of the drug that is appear in the blood after oral administration to the amount of the drug that appear in the blood after the intravenous administration, and usually is uh, calculated in percents, so that is why it's multiplied by 100. So to calculate it precisely, we can uh, draw a graph that will show the plasma concentration after the intravenous injection. So this is an intravenous injection, and the plasma concentration after the oral administration. So after these two administrations, you can compare the area under cube. So uh, this area that is under these cubes is more precisely will represent the amount of the drug, and this second area is this one. So after calculation, so you can calculate it using a differential equation or using a graphic method. So uh, this formula is for calculation of bioavailability. So area under cube after oral administration is divided by area under cube after intravenous injection and multiplied by 100%. So it's calculated in percents. Uh, the right after the administration, the drug goes. So the first stage is absorption. So absorption will take place depending on the drug administration. It can take place in different sites. So in case of the oral administration, the drug will absorb in the intestine, then to the blood, and so here in the actually in the uh, in the gastric also, uh, but mostly in the intestine. So after absorption, the every drug, so after oral absorption, drug will go through the portal circulation, so they go to the liver first. So because the veins of the abdominal veins will pass through the liver before they go to the heart. So every drug that is absorbed will first metabolize in liver and then go to the heart. And that's why if you have a drug that is with influence to the heart, uh, it should be metabolized in liver uh, less, so it can go, so the concentration, so the drug will go to the heart only through the liver. So this is usual way. But when you administer intravenously, then it will pass the liver. It will not pass the, it will go directly to the heart, and that is why it's preferred method for the heart drugs. So the drugs acting on heart. And also the during the rectal administration, the rectal way will bypass the portal circulation and will go, half of the blood will go to the heart uh, directly, not through the liver. So that is why rectal administration is sometimes preferred for the heart diseases. So after the absorption, there will be a distribution, and so there will be distribution, metabolism, and elimination phase. So for the distribution phase, the drug is, the concentration of the drug is decreased fast, because the drug will go from the blood to the other parts of the body that are much larger than the volume of the blood, so about 14, even 20 liters, while the blood is only 4 liters. So, and that is why the concentration of the drug drops fast. And then the elimination phase, the drug is metabolized and then eliminated from the body through the urine or other fluids. So, and this is a slow process and takes about 4 hours. So distribution phase is rather short, about half an hour, 1 hour, and then elimination phase is about 4 hours, and it's much slower. So and these two phases, usually if you draw the graph, the curve will be the exponential. So the type of the curve is exponential, that is a bow curve looking like this curve. So, and this is true for the most of the drugs because it's convenient, and most of the drugs will show this type of the distribution and elimination. So, but there are some exceptions from that, and this so some drugs will show a 0 time elimination. So this uh, this 0 time or 0 kinetic elimination means that the concentration of the drug will decrease equally through the time. So and this is usually for is common for the spirituous, like the alcohol will distribute through this way, and actually it's not very common for most, it's very rare case that the drug will show 0 time elimination. So 0 time or 0 kinetic so it's not, sorry, not 0 time, it's 0 kinetic elimination means that the rate of elimination will not change much, so it will not depend throughout the time. So this curve is decreased, but it's straight. So because it decreases because the amount of the remaining drug is decreases, but not because of the rate of elimination decreases. And there are several parameters that will describe the kinetics of the drug absorption and elimination. So, and for examples, to explain the way it's calculated, we use a infusion, drug infusion through the system. So the system is system is connected to the vein, and then infusion will start slowly through the intravenous vein. So when we start infusion, the concentration of the drug will increase in plasma drug concentration will increase slowly, because infusion is done through the system, it's done by drops. So it was this way. This is actually intravenous infusion. So the concentration will increase, and eventually the rate of uh, administration will be the same as the rate of the elimination. And at this point, we will tell that the drug is reached the steady state drug concentration. That means the concentration is constant and it will not increase or decrease. So, and this is the good thing, that because usually during this steady state concentration, the therapeutic effect of the drug is the maximum, so it's optimal for the patient. So the time from the start of the infusion and to reach the steady state concentration is actually the time of the onset time. So if we divide, so if we take the maximum concentration and assume it's 100%, and then we can calculate the half of this concentration, and then we draw a line, so this straight line. At the point it will cross the graph, we will draw a second line that is perpendicular to the x-axis, that is time. So, and we will get a half elimination time. So time t1 divided by 2 is half elimination time that is constant for every drop, so it will not change if we increase or decrease the rate of infusion or the dose. So every drug has a constant half elimination time. And then if we multiply this time by 2, then the we will see that in 2 half elimination times, like if the half elimination time is 15 minutes, then after 30 minutes, half an hour, we will have a 75% of the concentration, and then in 3.3 of time of half elimination, then the concentration will be 90%. And we roughly assume that in if in 4 times, like in somewhere here, like in 4 times in time half time multiplied by 4, so after this amount of time multiplied by 4, will we reach almost 100%. So for the educational purposes, we can assume that it's 100%. Actually, it's 97 and 5, and you will never reach this 100% because this is hyperbola. But still, for the educational purposes, it's fine. Also for the practical purposes too. So then, after drug will reach the maximum concentration, the uh, the drug. So do you need to make a break?
Yes, please.
Okay, let's make about 15 minutes. Good.
Yes, good. Thank you.
Okay, good. Let's make a 15-minute break and then we'll continue. You can stay here, so please don't disconnect.
Okay, thank you.
So let's continue the lecture where we are stopped. Any questions so far?
No, thank you.
So have a nice meal.
Just a cup of tea.
Okay, then cup of tea. That's fine. You can actually take a breakfast during the lecture, because during the lecture you don't need uh, not you don't need to speak much. You just need to listen. So as far as your ears are mine, I'm fine. So you can have a meal. So you can like do something with your hands. So but just look on the screen and listen to the lecture. So this cube actually is very characteristic. So this this type of the cube is common for the most of the drugs. And so on the y-axis we have a plasma concentration that here is actually in percents, but it can be actually is C that stays for concentration, and SS is actually steady state concentration, that is 100%. But it can also be calculated in the grams per milliliter or per deciliter. So this is actually the y-axis, and the x-axis is classical time. So actually in minutes or hours, usually hours. So because most of the drugs will develop uh, the action in several hours, so you need at least after most of the after oral administration, drugs will reach maximum effect in about 2-3 hours after oral administration. After intravenous, it can be about half an hour, or for some drugs, yeah, even several seconds. So everything here varies a lot, very much. So for the infusion, so this cube is mostly for infusion, and after the infusion, the drug will reach the maximum concentration or steady state concentration, and this steady state concentration will vary on the rate of the infusion. So the faster is the rate of infusion, the higher will be the steady state concentration. It still will be 100% for the particular concentration, sorry, for the particular rate of infusion, but will be different in if you calculate the concentration not in percent but in grams per milliliter. That will be different value each time for the every rate of infusion, and also for every person, and also for every drug. So, and even for the every system, sorry, that is used for the infusion. So after this steady state concentration, if we stop the infusion, then the concentration of the drug will slow down, and this concentration will be the double mirror of the first concentration. So the time that is required to decrease the concentration twice is called the time of half elimination. So it is the same time that is required to increase the drug concentration by 50%. So actually this is pretty the same. So this same curve is exponential curve, and the same t1 1 divided by 2, so half element. So this parameter is called half elimination time, because during this time the concentration will decrease twice, so the drug will eliminate by half. That is why, hence the name, the half elimination. So and so this is the same. So this and these are times are same for the current drug. But every drug has a constant. These values are constant for every drug. Will not depend on the person, on the constant, on the drug infusion rate, on the dose, or route of administration. So half elimination time is constant for the drug. And this is the last actually slide, and then we will discuss, and you can ask questions on anything that you not understand well, or want an additional explanation. So on this graph we compare the intravenous and oral routes of administration. So the same.
I'm sorry.
Yeah.
I'm sorry to interrupt you, but we cannot see the graph. We cannot see the presentation.
Sorry, you should. Oh, my bad. I forget to forget to start the presentation. So 1 moment. So you couldn't see before too?
No, it's just after the break.
After because after
after
I
the break,
showed you. Okay, good. So 1 moment. So now better?
Yes, thank you.
I will explain the previous slide again, because I think you could not see the presentation before. So when we stop the infusion, the concentration will slow down and the QF will be the same as the increase in the concentration of the drug, and then time of half elimination will be the same. So actually these graphs, this and this graph is double mirror, so you mirror your graph, and this time of half elimination and this will be equal, so the same. So that is why this parameter is called time half elimination time, because during this time the concentration of the drug will decrease twice. So this is just to remind you about this slide. So and then this is the last one, and we compare the intravenous and oral routes of administration. Intravenous infusion is in blue and oral administration is in red, because intravenous will go to the vein, that is color blue, and oral actually goes to your mouth, that is color red. So the drug concentration is on the y-axis and time is on x-axis. The time here is calculated in elimination half-life. So this is constant parameter, like a 15 minutes, or so this is actually, assume this is like a half an hour. So this is actually time, and drug concentration is in some value, so that is not very important. So we only compare it for the same drug and for the same person, so we use different ways of administration. And if we use intravenous infusion, the concentration will increase steadily and the line will be almost straight. So, but if we administer drug by mouth orally, then the concentration will not be very steady, so it will increase and then decrease, increase and decrease, increase, decrease, increase, decrease, and at the some point of time it will increase the same rate as it will be is decrease. So actually I need to explain that this actually one tablet. So we administer the tablet at 0 point, then the next tablet comes at at exactly the half elimination time. So this is half elimination time, assume is 1 hour. So then we take a second tablet in half an hour, and then the third tablet in another half an hour, that is 1 hour from the 0 point, and so on. So every this small cube is one tablet. So one tablet, second tablet, third tablet, fourth tablet, fifth tablet, sixth tablet, and then as when we take the sixth tablet, the concentration, the plasma drug concentration increases the same amount as it will decrease before we take the next tablet. At this point, we will reach a steady state concentration. However, the concentration will not be as steady as it is during the intravenous infusion, but it will vary slightly around that point. So, and this variation usually is not much now. So because the dose, so the increase is much uh, larger. So the and if we look from the far, we even cannot distinguish this increase. It's like actually a very small increase and decrease. But when we increase the dose, and the dose is actually will be higher, and then these increases will be also higher. So actually this fluctuation of the dose will increase as well. That is why when the high doses are prescribed, the the preferred method of uh, application is intravenous, because the intravenous will be still steady and the concentration will be constant. But for the oral administration, the concentration will vary, and that is why here and here, so the difference is much larger than here. But if we decrease the dose, then the difference is so the oral route of administration is almost the same as the intravenous. So for the oral, that is why for the oral route of administration, low doses are better. For the high doses of administration, intravenous is usually preferred, but depending on the drug, this difference can be vital or not vital. So it can be important, it can be not much important, because most of the drugs will be still effective in here and here as well. So even in the, and then these high doses will not lead to the toxic or the adverse effects. So but for other drugs, this difference is important, and that is why they are only administered intravenously. There is no oral route available. So this is the differences in the administration of the drug, and every way of administration will show a different profile. So the graph will be different. For example, if we administer intravenously, if we inject the drug, sorry,
Teacher, does this mean that the intravenous medication is better than oral dosage?
it's better because the concentration will stay at the same level always,
Mm-hmm. Okay.
unless you stop the infusion. So when you stop infusion or you decrease the rate, it will decrease, or when you stop, it will decrease. But as far as you are administering the infusion, the concentration is straight, like perfect.
Mhm. Thank you.
So any other questions? So this is the last slide. Actually, we are done with the presentation. And uh, uh, what are your questions? Uh, what are your questions for the lecture? So we have about half an hour for the questions. Any other questions so far? No questions? So
No, thank you.
I try to save more time for the questions, because the more questions, the more discussion, and the more you understand. And that is a good thing about studying in groups. So during the, if you don't have questions, then I will explain you a little bit further about the uh, this about the metabolism of the drugs. So the metabolism of the drugs uh, mostly takes place in the liver, because most of the enzymes are synthesized in the liver. And there are two types of the reactions that take place, uh, and we divide them to phase 1 and phase 2. So phase 1 are those reactions that uh, will usually in, increase the they can increase or modify the drugs. So they will, so the reactions are oxidation uh, and uh, reduction. So these two types of the reactions can activate the drug, because some drugs are prodrugs and they are not active when administered. And first they need to be activated in the liver. And other drugs will have an active metabolite. So, and for some of them, the metabolites are even more active than the original drug. Like, for example, morphine is metabolized to morphine, uh, 5-glucuronide and 6-glucuronide. So one of these metabolites is even more active than the morphine is itself, and, and then that increases the efficacy of the drug. So, and after this phase 1, the drugs will distribute and make an effort. And after the distribution phase, there is an elimination phase. And for elimination phase, the important thing is the reactions of phase 2. These are conjugation and acetylation. These reactions usually deactivate the drugs, so they don't act long much. So that decreases the activity of the drug and prepares drug for elimination, because usually acetylated drugs are more uh, more hydrophilic, and that increases the rate of the elimination because most drugs are eliminated by the urine, and the more polar is the drug and more hydrophilic is the drug, the faster it will be eliminated with the urine. So, and most of the most of the drugs eliminated as the glucuronides. So glucuronides and acetylates. So, for example, morphine, a 6-glucuronide is the main metabolite of the morphine. So, and it is also used to determine the uh, to determine the uh, to to calculate the presence of the drug uh, in the body. So like, or presence of the drugs of abuse, for example, in the body, because uh, once mm, the drugs are consumed, they will appear in the urine, so and stay there for a long time after, because elimination is continuous process and takes about several days, or sometimes it can take even half year for some drugs. So this is a base of the metabolism, and the liver has an enzymes that are divided to families. In back days, we only uh, we only talk about the one like enzymes in general, but nowadays there is a more complicated classification of the enzymes, and the enzymes of the liver are called CYP, that stands for cytochrome P450, so 450. So they are called 450. So cytochromes of P one of 450. 450 is uh, the wave, the number of the wave that they have a peak on during the chromatography detection. So these enzymes have a characteristic peak uh, on 450, uh, and that is why they are called cytochromes of P450 or 450. So, and uh, nowadays these enzymes have several families, and they are grouped according to the chemical structure and uh, the uh, the reactions they will facilitate. And most of the common of these are is a cytochrome CYP, CYP3A4. 3A4 is actually the most common one, and it will metabolize about 1/3 of all the drugs. But there are also many others, so the classification is actually is number and then letter and then another number. So the for example CYP3A4 means it is a family 3, class A, and type 4. So this is a classification for the cytochrome enzyme. So you don't need to learn all of that, but you can remember I think 2 or 3 of them, because sometimes the uh, patients have a different activity of these enzymes, and the drugs will be eliminated slower or faster depending on the activity of these enzymes in a different patients, like of different ethnic patients will some of them will don't have the enzyme at all, so then the drug will be eliminated much slower. So and these enzymes are also can be activated and inhibited by drugs and other substances as well. For example, some food as well. For example, uh, the what is the orange, and then there is like an orange. It's juice like an orange. What is the name? It's mock red. So it's very popular in. I think it's produced in Egypt too. Sandy.
No, I don't know it.
So it's like there is an orange juice, and there is a like I forget the name. It's in Russian. It is. They don't sell it now. Unfortunately, I liked the juice very much, but it's disappeared in the markets recently. I forget the name because it disappeared in the markets. I even forgot its Russian name. So so there is a juice, and this juice uh, increase the activity of the enzyme, and that is why if you consume a drug with this juice, then the drug will be eliminated faster, and then you will not get your treatment. So that is why when you prescribe a drug, it's important also to us not to consume some foods like uh, okay, I will if I remember it till the lecture, I think I can tell you, but just
I've heard that in order to take the drug, I have to swallow it with water and not soda or anything because soda deactivates the drug. That's what I've heard, but I'm not sure if it's true.
it's not true. The soda itself will not deactivate the drug, but the soda will decrease the acidity of the stomach, and also um, that can lead to GI disturbances, and then because this can be a reason to uh, decrease the uh, the efficacy of the drug. So and but the reason for the it's good to use water because the water is also always constant, so it will not and it will not influence to the stomach, it will not influence to the drug, and some of the drugs can be inactivated if they are acidic. So like if you drink acids drug that is solution and acid, then yes, but there are no drugs that are actually acid solutions, so that is why you can use a soda if you don't have water. That is not a much deal, provided the soda will not make some uh, GI disturbances to you. So that is fine. You can also use soda.
I understand. Thank you.
So I'm looking now on the yes, grapefruit. Do you have a grapefruit?
Yes.
So
Yes.
the grapefruit is increasing the activity of the enzymes. So that is why you should not use a grapefruit, but for soda you can use.
Okay. Thank you.
And also soda actually is a drug itself because it can be used uh, for the acidic acid, so acidic stomach. Like if you eat much and then you feel the heartburn, and then when you drink a soda, it will it decrease the heartburn. However, the soda when soda goes to the stomach, then it will react with the hydrofluoric acid of the stomach, and then the result of the reaction is actually H fluorum plus HNO3, sorry, sodium hydrocarbonate, so it's a natrium HCO3. So the result is of this reaction is CO2 plus uh, the mm, sodium chloride. So this is, and this CO2 that is actually a gas will dissolve in the water, and then will result in the irritation of the gastric mucosa, and then you have GI disturbances. Actually, you have an ulcer. So the CO2 will lead, eventually, if you use it frequently, will lead to the ulcer. So that is why it's not recommended to use it with the drugs, and actually don't use it much as well, because especially when used in large quantities, like several cups, uh, it can lead to the irritation of the stomach wall, irritation of the stomach, and then if you use it like every day and frequently, you will develop an ulcer. uh, and also that increases the acid uh, uh, secretion in the stomach. So it decreases the acidity first, and then after some time, like 15 minutes, half an hour, it will increase acidity, and then you will have a heartburn again. So that is why it's not recommended for the heartburn. However, some drugs, even in tablets, they have sodium hydrocarbonate uh, as a active substance. Other questions? No. So actually, I love grapefruit very much, but I forget the name because it's not currently available in our country. So
But I think it was available in supermarkets
it
last
was
semester, yeah?
where
Last semester, maybe.
last semester. It was like several years ago everywhere, but now I have a hard time to find it in supermarkets. They have a mix, like a grapefruit plus lemon plus orange plus something else, and actually the taste is not the same, but I like the taste of the grapefruit more. But unfortunately it's not available. But still, it
I
is. Sorry,
I think you can find it in Petyorshka. I've seen it many times.
with what? Sorry.
I think you can find it in Petyorshka. I've seen it many times.
I've seen it too, but now it's not available. It's like uh, I have a convenience store like around. I walk around my home. There are about 5 of them, but there is no at all. So it's disappeared for some reason. I think they ran out of the stock because of the supply chain. So supply is stopped recently, and that is why. So usually supply stops, like supply chains have about half year uh, uh, warehouse, like they supply in advance. So when you stop supply, like during the breakdown, so the supply will still uh, give you the goods, but for a limited amount of time, and then they need a time to uh, recollect this buffer. So this is why I think it will appear only next year. So that is why the patients will not use the grapefruit juice. It's good for you as a pharmacist, so no need to ask. But when you when you dispense the drug, then you should educate the patients not to use the soda. Also, actually, soda you also should mention that it's better not to use soda, grapefruit juice. And for grapefruit juice, you should not consume it at all. Like not just to drink the tablet with the grapefruit juice, but also don't drink grapefruit juice at all during the treatment, because grapefruit juice will absorb, then will uh, will decrease the activity of the liver enzymes. uh, so if you drink the juice every day, even if not without the tablet, so grapefruit juice will not act on the tablet directly. It will act on the enzymes in the liver of the body, and then it will act on these enzymes will uh, increase in activity and act on the tablet that is consumed afterwards or before. So that is why you should divide grapefruit juice and other substances that actually act on, like some drugs can also modify the activity of the enzymes too. So that is why when you combine two different drugs, one drug can increase or decrease activity of the metabolism of the another drug, and that is also a problem during when you prescribe. That is why physicians don't like, they like prescribe much drugs, but they should not prescribe much drugs. So that is why you should, when you see several drugs in the prescription, you should check if they are compatible with each other, and if they are not compatible, then you should not dispense the drugs, and call physician and ask him to replace the drugs, or ask him how to manage this patient, because some drugs can be vital, other drugs can be omitted, so to or can be postponed for some time to prevent the interaction between the drugs. Or if it's not a case, then if physician requires that all of the drug for the treatment, then the dose can be adjusted. So physicians, experienced physician usually will uh, will increase, so will correct the dose. So will increase the dose if the drug are influence each other. So if one drug increases the metabolism, then the dose can be adjusted to prevent so the concentration will stay the same as if they are not interacting with each other.
Teacher, so mixing like taking two medication at the same time, the one can interfere the other and reduce its efficient, but can it form third formula which can harm the body, or never happened?
Usually the drugs will not interact directly with each other uh, to make a new drug inside the body. Like if you two two drugs will not interact directly with each other in a reaction and result in third drug that is toxic or that is incompatible with the body. So that is usually not a place. sometimes for alcohol, for example, alcohol can lead to like alcohol can increase the dose of the drug, and then if the drug is a toxic itself, and slight increase in the dose can result in toxicity. So this is the only case. But for most of the drugs, they are safe and will not result in any toxic reactions. Because for the most of the drugs, the overdose should be much, and um, even with the um, interaction between the drugs, it's not enough to make the dose toxic.
And teacher, about the graphs you showed to us at the beginning, where we can find them.
Graphs, everything we discuss is in the textbook. The link is available at the educational portal. The link to I sent the link to the Sandy. I think I can send it to you here as well. One moment. Can find it in the chat of the meeting. One moment. Here it is. Please follow this link and subscribe to the course, and download the textbook. Your textbook is called Lippincott Illustrated Reviews Pharmacology, and the you also you can also find your plan that is called syllabus. So your plan have topics, and for
Is it called pharmacology or pharmacology pharmacy? Because
pharmacology pharmacy.
Because it says here you cannot enroll in this course.
Yeah, me too. I couldn't enroll.
Why you cannot enroll? Have you signed into the system?
Yeah, of course we did.
Yes.
All of this one, we can't enroll to it.
Wait one moment, I will check if you can. You should actually. So also you will find your topics, and then for every class there are the numbers of the chapters that are in the textbook, so you can prepare in advance. Strange, because it should be open for students to enroll. Okay, I will check later if I can enroll you myself. I think yes, I will enroll you myself then if you can't. So after this lecture we have a practice, so I think I can do it during the practice. So after lecture, please stay here.
Okay, maybe because the enrollment options, you have to be in course 3 or 4th.
No.
It was written there. Because it was. No, I know we can, like we're supposed to be can, but there is written semester 3rd and 4th.
Semester 4th. Well, I will check shortly after the lecture. Okay.
Okay.
So, any other questions?
What will we do in our practical class?
On practice, we will discuss those topics that we presented during the lecture. So actually, I will ask you about what you understand, how you understand, and check if you understand correctly.
So, teacher, please, if I have a little cold, I didn't visit the doctor, and I took some medication from the pharmacy, like without prescriptions, can I mix medications, like take two with each other, or it will be dangerous?
Sorry, uh, you can make what medication?
Like I have like little cold and so on, and I didn't visit the doctor.
Okay.
So I went to the pharmacy and bought some things for cold. And can I take two different medications with each other at the same time, or it's dangerous?
Usually it's not, and
So,
usually those drugs that are uh, dispensed without prescription, they are over the counter, so they are allowed to dispense without prescription. They
mhm,
are less efficacy. They have less efficacy than the prescription drugs,
mhm.
and they usually can be combined safely, and
Oh,
so you can use them safely. But for the cold, most of there, there is no treatment for the common cold. So the drugs prescribed are, most are only to treat the symptoms of the disease, not the disease itself. So uh, usually it's like a paracetamol for the to uh, decrease the temperature, so from the temperature, and then and some analgesics, also paracetamol or any other one, and some of them are also have some uh, uh, a vitamin C to
mhm,
increase, so uh, to to replace the deficiency in vitamin C, and uh, some antipyretic components, and also anti-inflammatory components. Like most of the some of over-the-counter drugs are combined drugs actually. So like for
mhm,
example, Teraflu, or something from the flu, drugs from the flu that are over the counter, usually combined and have analgesic from the pain, then anti-inflammatory, something anti-inflammatory to decrease the inflammation and swelling, and then the anti-pyretic to decrease the temperature, because these are symptoms of the cold, but it will help you uh, to stay well, but it will not decrease the duration of the disease, or will help you to cure the disease completely.
mhm. Thank you, teacher.
So actually, the during the common cold, you are treated by your body immunity system, not by the drugs. And this is also true for the uh, flu, like for the uh, and for many viral diseases, and for some bacterial diseases as well. So we will discuss that in detail next year. So actually, this is the last one of the most comprehensive topics, and then at the very end of the course. More questions? No, if there is no question, then I think we can conclude with the lecture. Thank you for attending, and see you next week. Bye bye.
You will send us a link to join the practical class, or?
No, stay here. We don't need to make a new presentation.